If you're the parent or caregiver who's concerned about a child's speech sounds, or maybe you're working on a child's speech sounds with a therapist, you must have heard the term lisp. And you might be wondering what exactly is a lisp, what you should be worried about, what you shouldn't worry about, and what are some tips that you can use to help your child in case you are starting to see a lisp. Well, you've come to the right place. But before I get into that, a quick introduction. Hi, my name is Amini. I'm a speech and language pathologist with several years of experience working with children and their families to maximize speech and language development. I have a private practice, Smarter Speech, in the Bay Area where I do the same. And my mission with this YouTube channel is to empower parents and caregivers, especially those with children under the age of 5 or around the age of 5, maybe even 6, because this is when a child's language and speech and brain are developing so rapidly. And just little changes that you make in the way you talk and play can have huge implications, not just for how speech and language develop, but also for how learning is going to develop in the future. So without further ado, let's get into it. Lisps. What is a lisp? So normally a lisp is identified when the sounds S and Z, maybe SH and CH, are produced in a way that's slightly less clear than regular. So there are two main types of lisps that you want to look out for. The first one is a frontal lisp. So a frontal lisp happens when the tongue sticks out of the mouth a little past these front teeth. That's what we call a frontal lisp. So to give an example, if you were saying C, the word C, it would be C. Or if you were saying the word buzz with the Z at the end, instead of buzz with the tongue tucked in behind the teeth, you would hear buzz, buzz, like that. So the tongue would stick out a little bit. So that's a frontal lisp. And normally any intervention for a frontal lisp focuses on bringing that tongue back, making sure it rests behind either the front bottom teeth or front back teeth. Both are okay. And that's something that a speech therapist would work on. The second type of lisp is a slightly more complicated lisp, and that's called a lateral lisp. So what happens with the lateral lisp is instead of the sound coming from behind the teeth, where the tongue is placed behind the teeth, the sides of the tongue lift to make a kind of slushy sound. So for example, if you're saying that same word C, instead of C, you'd probably hear she, like that, slushy. Or you might hear for the word zoo, you'd hear shoo. And for shoo, for example, with that SH, you'd hear something like shoo. So instead of the lips come in front and the sound going towards the front, the sound would go towards the side, like that. So lateral lisp is a little bit more complicated because you have to spend a lot of time focusing on getting the sound forward and also on the tongue placement. And that is definitely something that a speech therapist works on. Sometimes if a child has hearing loss, you'll see a lot more of the lateral lisp, that the tongue's lifting from the side. And in order to help intelligibility or speech clarity, a speech therapist might work on bringing the placement more forward than to the side. So those are our two types of lisps. You know what to look for, and you know what sounds to look for each of those things. Is there a slushy sound, or is there the tongue sticking out to the front? So what should you do if you notice that your child has a lisp? Like I mentioned before, a lisp is a kind of tricky one. So you want to make sure that you're speaking to a speech therapist, getting a referral to a speech therapist from a pediatrician or through your school. Sooner is better than later. That being said, normally until around the age of 5, I still wait, 5 or 6. I wait to see how the S will develop. Sometimes the child might sound a little bit slushy, or the tongue might be coming out, and that just corrects with age. I've definitely seen that happen before. But if you're at 5.5, 6, 6.5, and you're still noticing that you're concerned about that S sound, it's a good idea to get intervention sooner than later, or at least get a few sessions to learn some ways to help your child. Another thing that you can do is emphasize certain sounds yourself. So you might think, well, what does that do to help my child? You're one of your primary one of the primary speech and language models for your child. So whatever you are saying, your child is imbibing like a sponge. So if you take some time to emphasize words that have the S sound, the Z sound, the SH sound, the CH sound, and really show how you're making those sounds, that will go a long way in helping your child while you're trying to get some help or while you're working with somebody else. So for example, I like to talk about, especially with S, which is a great way to practice bettering a lisp. So I like to talk about plurals, possessives, and apostrophe S. So let me give you an example of this. Every time I'm counting something, I would emphasize the S at the end. So for example, say I'm looking at this train here, I would emphasize track, 1 track, 2 tracks, 3 tracks, 4 tracks, or maybe I'm counting cars, 1 car, 2 cars, 3 cars, etc. So notice the way I held out that F. I really emphasized it. I added a little extra air just to show how I was making it. I was also smiling a bit so that the child can see that the sound went forward. They can hear the type of sound that was made. And they will start to pick up and maybe even copy the way you're making that sound. They're not going to copy holding it out like that. That's not going to happen, but they will notice the placement of your tongue with time. I also like to do possessive S. So say, for example, you're playing a game like Spot It, and you're talking about whose turn it is. Whose turn. You can say mom's turn, dad's turn, sister's turn, baby's turn, friend's turn. So every time you're talking about turns, that apostrophe S is a great time to really press and emphasize that S sound, which can be helpful. The last one is apostrophe S. So every time I'm talking about something, I just add an apostrophe S. So that's so cool, or it's fun to play this game, or it's time for a lunch, or that's a great idea. So just when you're talking and playing with your child, you can emphasize, we say that's, it's, etc. a lot. So you can emphasize that S as well, the way I'm doing. You might not see results immediately, but you really taking the time to emphasize that S and draw attention to it will help your child as they work on reducing that lisp, as they work with a speech therapist. So that's a great way to get started. Your child will notice, even if they're not immediately repeating after you. So those are our 3 tips. I hope you know now what a frontal lisp is, what a lateral lisp is, talking to a professional if you see either of those, and how you can help in the meantime or supplement whatever therapy is going on. All right. So if you're looking for more resources on speech sound development, check out some of the resources in the description box below. There's a link to our mailing list. You can receive a monthly speech and language tip in your inbox, themed to the season, themed to the month. There's also a link to our ebooks and our parent education courses. So you can take a look at those and see if there's something of interest. And I've also linked some of the materials that I used in the demos in this video. I hope that this tip helped you. Consider checking out our channel for more videos on speech sound development and speech sounds. If you liked this video, please give it a like or hit subscribe. Thanks so much for watching and happy talking.